inside the belly of a hulking airplane. It's not exactly an ideal ER.
Drugs are up. Where are we on function check?
Patients are here.
Lift.
This way. Thank you.
Come to me, come to me. Down to the bracket. Ready, lift. Move.
But these hospital workers from right here in Colorado have grown used to intensive care at 20,000 feet.
Let me have somebody get your vital signs. Do you have a pulse? I have a pulse.
Inside a cramped hospital ward crafted from a fuselage with simulated patients swinging from stretchers.
How's his breathing?
These medics are training to salvage the war wounded half a world away.
So once we get up to altitude, what the flight crew does is they assess their patient's vital signs to make sure they are tolerated the stresses of flight.
Colonel Kathleen Flaherty from Colorado Springs just spent months in Iraq and Afghanistan leading an entire Air Force Reserve squadron that treated 3,000 patients there.
You have controlled the bleeding on this dump. How fast are you giving your IV fluids?
On this training mission, we are perched high above the mountains of Colorado, but mimicking an actual combat medical evacuation, fake victims and all.
Cerebral hemorrhage that we'd be looking at.
The wounds are as real world as possible, the kind of things they'd be seeing in Iraq or Afghanistan. For instance, this patient has a broken leg, this one with shrapnel wounds to the leg and the arm. They'll treat these patients, get them stable, and to a hospital as soon as possible.
His pulse is racing.
That means rushing patients to better equipped medical centers in Germany or even back here in the U.S. in a hurry. It is turbulent work in more ways than one.
Doesn't talk about any type of blast, possible injury.
Donna Olson, a mom of 3 who works as an emergency room nurse, just returned from Afghanistan, where she witnessed the unimaginable.
You'd have patients with as many as 3 limbs that were amputated.
Carrie Williamson has a 19-month-old boy she had to leave behind in Colorado Springs when she was deployed for several months last year. On one especially difficult mission, she helped treat 7 victims of a Humvee accident, 2 of them multiple amputees.
It was a very emotional plane. He's at high risk for acute ischemic stroke.
It is the kind of thing even working in an ER back home can't prepare you for, but it drives home the importance of what they're doing up here.
The more practice that you get, the better you are when it's real life.
And even once they touch down, those skills they've honed at 20,000 feet
2 on the left.
can help them at their day jobs. Back here, treating us civilians in Colorado.
Ready, lift.
In emergency rooms that are a little more ideal than the belly of an airplane.